Okay, so this is a McConnell taping for the patello-femoral joint or for the kneecap, and essentially what we're trying to achieve with this taping is assisting in getting the kneecap to track a little bit better in the joint. So we're essentially trying to pull the kneecap across towards the middle of the joint or assist in keeping it towards the middle of the joint, and there's a couple of different components that we can apply. So first we're going to apply some Fixamol or Hyperfix to protect the skin and feel for where the kneecap is. So what looks like the kneecap, a lot of that is just fat pad and soft tissue underneath. So feel for the margins of the kneecap at the top and the bottom. And we want to cover that. Because we're pulling to the inside, we don't need to start very far on the outside of the kneecap, but we do need to overlap the tape and come quite a way around towards the middle. So now we're going to pop the brown tape on, and this is really what's doing the job for us. You can tear the tape or you can measure off the piece that you need and cut it. If you're cutting it, always cut it off short of the distance that you would like to cover, because we're going to be pulling the tissue on the inside up. So rub the tape on the outside of the knee there just to fix that into position. And then we're going to use the thumb of one hand to push the kneecap across to the middle, and we're using the fingers on the inside to lift that tissue up. Then we're going to apply the tape nice and tight over the top and just fix that down. And we're looking for a couple of these little skin creases or skin puckers there. If we don't have those, then we probably haven't got the tape on tight enough. So that first piece of tape is pulling the kneecap across. The second piece of tape that we're going to apply is just going to pull the inside of the kneecap down and decrease the tilt on the kneecap to get it sitting a little better in the joint. So this time we more or less start onto the top of the kneecap. And again, give the tape a bit of a rub to fix it in place. And again, we're going to use our inside finger to lift the tissue up on the inside of the kneecap before we pull that over nice and tight. And we should have a few more of our skin puckers there. For most people that will be sufficient. If you like, you can apply one final piece of tape where we start on the outside again, but we're sticking that tape on a bit of an angle downwards, and then as we pull, we're going to pull the tape around and up just to de-rotate the kneecap, and then give that a little bit of a rub to get that to stick. So we're just going to bend a couple of times just so that the tape doesn't pop off, and then just to get that to lock off and to last a little bit better so that the edges of the tape don't rub on clothing, and also so that we get the brown tape to stick for a little bit longer. We're just going to pop another piece of our Fixamol or Hyperfix over the top, which will just stop those edges from peeling up and stop the tape from popping off and get that to last for a little bit longer.